Today we will discuss about the various topics regarding the subject community pharmacy. A little touch should be there related to the previous lecture. So in previous lecture we have discussed about various childhood diseases. Also we gave a little touch to various definition like community pharmacy, which is the hybrid of professionalism and business. uh, Hospital pharmacy, which is basically drug oriented one, clinical pharmacy, which is a patient oriented one, and then we define public health, which is science and art of preventing disease, promoting health, and prolonging life through organized effort of the society. After that, we basically discuss detail about the childhood disease, just like asthma, which is one of the chronic inflammatory disease of the lungs or airway, and to be most commonly characterized by difficulty in breathing, chest tightness, wheezing, and severe cough-like condition. Obviously, there should be a mucus-like secretion. Then we give basically touch toward the sign symptom uh, and types. Most commonly restricted toward the children, and obviously then later on we discuss about the treatment of the asthma. Then we give a little touch toward the sore throat, causative agent for the sore throat, trigger, various trigger that trigger the situation, and treatment. And then we focus on the ear problem, that is most commonly otitis interna and externa. Depend upon the area of the ear that is basically affected most commonly, and we mentioned that amoxicillin is basically the drug of choice in such condition or circumstances. And as for today topics concerned, so we have to discuss multi-topic in today's lecture. So on priority basis, the first one, that is the dengue fever. So one thing keep in mind, dengue fever is also known as breakborn fever or mosquito-borne infection. One thing keep in mind that this is just like a flu-like illness is basically there in case of the dengue fever, and the basic agent which is responsible for the dengue fever is to be known as virus. So one thing keep in mind, there are four different serotypes of viruses are there, and all these viruses have the capability for causing dengue fever, and the carrier which is responsible just to transfer such viruses toward the host system is to be known as Aedes mosquito. So Aedes mosquito is basically responsible just to transfer such viruses toward the host system. If someone is suffering from dengue fever, so dengue fever as such, if properly investigated and diagnosed on time, is not a lethal one. Anyhow, sometime the dengue fever, if not properly investigated or diagnosed on time, so this may be a lethal one or worse the condition, and such type of the condition is to be known as, that is the dengue shock syndrome disease and dengue hemorrhagic fever or dengue hemorrhagia. So these are the two severe form where basically hospitalization is most commonly needed. According to the CDC, 400 million people are most commonly infected by this virus on annual basis. Anyhow, the number or the figure is most commonly too much less in the United States, and outbreak was most commonly observed in Texas, Florida, and Hawaii. And nowadays, the dengue fever is most commonly occur in the month of September, October, and most commonly the Asian community and society is most commonly affected. So as for the causes concerned, so we have discussed already that most commonly four different serotypes are responsible, and most commonly mosquito is responsible just to transfer such virus toward the host system, and most commonly two types of viruses are responsible. It is the Aedes aegypti and more rarely Aedes albopictus. So Aedes albopictus, which is rarely involved, and most commonly Aedes aegypti is most commonly responsible for causing such problem. The most common sign symptom, so sign symptom basically variations there depend upon the situation. If a mild dengue fever is there, so the most common sign symptom will be just like itching muscles and joints, severe body rashes that may be disappear and reappear with the passage of time, elevated body temperature, too much high fever, intense headache, severe headache-like condition, pain behind the eyes, and a vomiting-like condition will be there. The next thing that is almost related to the dengue fever, which is not lethal one, can be easily treatable, which can be easily treated and easily manageable one. Anyhow, if not properly investigated on time, if not properly managed, so this may cause dengue hemorrhagic fever, and as from the name it is clear that in case of dengue hemorrhagic, mostly it is related to hemorrhagia, and bleeding tendency will be there, like it is bleeding from mouth, gums and nose, climb skin, damage to the limb and blood vessels, internal bleeding phenomena, sensitive stomach, small blood spot under the skin, and decreased blood pressure. This is most commonly related to the dengue hemorrhagia. It's too much lethal condition. Whereas for the dengue shock syndrome concern, this is too much lethal, and the most common sign symptom of this condition is the or intense stomach pain, disorientation, sudden hypotension, heavy bleeding phenomena, regular vomiting, blood vessel leakage, which is the most common reason. If not properly treated or managed, this may lead to death. As for the treatment concern, so at present time there is no as such dengue vaccine, so a supportive therapy or treatment is too much important, depend upon the condition and the severity. Symptomatic treatment should be there. Most commonly we have to recommend the intravenous fluid supplementation or drip-like infusion should be there. In case of severe dehydration, blood transfusion phenomena should be there, and hospitalization, if it's to be needed, important, so hospitalization should be properly there, and aspirin and ibuprofen like drug should be avoided. The next topic is for today's lecture is concern is pneumonia. So pneumonia, of course, this basically occur both in children as in adult candidates. Anyhow, we have to focus on pneumonia, which is related to the children. So this is one of the inflammatory condition of the lung region or infection of the lungs. What cause pneumonia in children? So one thing keep in mind, two type of agents are responsible, two type of microbes are responsible. It is the viruses as well as bacteria. So whereas in case of as for virus is concerned, so most commonly respiratory syncytial virus, which is to be known as RSV, or influenza flu type A and B or B, and most commonly the bacteria which is responsible for causing pneumonia in case of children is to be known as Streptococcus pneumonia. So Streptococcus pneumonia is also one of the bacteria. Symptom, so the most common sign symptoms are like there is difficulty in breathing or stopping of breath, not feeding properly, no wet nappy, severe fever and temperature. This may be that goes up and down, irritability and sleeping irritability like condition should be there. Most common sign symptom is for the treatment concern. So if it is due to bacteria, so of course we should have to recommend the potent antibiotic in such condition. And if it's a viral one, so obviously depend upon the situation, symptomatic and supportive therapy should be there. The next topic is poliomyelitis, simply to be known as polio. This is one of the viral infectious disease, contagious disease, and most commonly is caused by RNA virus. Belong to the genus enterovirus and family is Picornaviridae. So one thing keep in mind, this problem is properly eradicated from the European Society because of the proper immunization program in the European Society. Anyhow, as for the Asian Society concern, so a number of cases are still reported nowadays. This is because of a lot of the problem, because mostly people have no as such interest to properly vaccinate their newborn babies and children. So that's why it's too much important. It's one of the objective of the World Health Organization to immunize the children, especially in the Asian society, in order to decrease the disability, and simply we can say to decrease the morbidity and mortality in the Asian society. Whereas for the common sign symptom concern, so the common sign symptoms are, first one, elevated body temperature or high fever, sore throat, severe headache, of course vomiting like condition, fatigue, meningitis, yes, loss of reflexes, severe spasm, muscular spasm, and fluffy limbs and paralysis. This is too much common, especially. As for the types of the poliomyelitis is concerned, so one thing keep in mind that poliovirus basically have a direct effect on the spinal cord and the brain stem region. So most commonly there are three different types of the poliomyelitis. So the first one, that is the spinal poliomyelitis or spinal polio. The next one, that is the bulbar polio or bulbar poliomyelitis, and the next thing, bulbar spinal poliomyelitis. So in first case, spinal polio, basically there is a paralysis of the spinal cord. The virus have a direct effect on the spinal cord region, where in case of bulbar poliomyelitis, the main brain stem is basically affected, where in case of the bulbar spinal polio, which is the combination of the two, both the areas are affected. So as for the treatment and prevention concern, so this is one of the viral disease. So just a symptomatic treatment or a supportive therapy is to be considered the best way. Anyhow, the best way is to properly immunize the newborn babies and children in order to protect them from this contagious infectious disease. The next one, that is the measles. So one thing keep in mind, again, measles, this is not too much common in the European society. Anyhow, just like the poliomyelitis, still measles cases are reported annually in the Asian society most commonly, and mostly this is to be caused by a rubella virus. This is one of the RNA virus, belong to the family Paramyxoviridae, and the genus is a morbillivirus. So morbillivirus is the genus of this virus, where Paramyxoviridae is the family. So again, one thing keep in mind, that this is also one of the objective of the World Health Organization to protect the newborn babies and children from this contagious infectious communicable disease in order to properly immunize the newborn babies and children. The most common signs symptoms are, that is, high body temperature or fever, severe dry cough, runny nose, sore throat, inflamed eyes, and most commonly in case of measles, of course, there should be a severe rashes should be there on the entire skin. So these are the most common sign symptoms, and in communicable period is too much important, during which basically, yes, this virus can be easily transmitted from the infected person toward the normal one. As for the treatment and prevention concern, so measles, this is again one of the viral disease, this is too much contagious infectious disease, severe high elevated body temperature is there. So that's why a supportive therapy should be there, a symptomatic treatment should be there. Anyhow, measles vaccines are available in the market, and we have discussed in too much detail that of course we should have to properly immunize the newborn babies and children according to the schedule of the API. So one thing keep in mind that the first dose of the measles vaccine should be administered at the age of 9 months, where the second dose is to be recommended at the age of 15 months. So I think for today this is sufficient. The remaining we will discuss in the coming lecture. So today we have discussed multi topics so as for the summary concern, and that is the first one that we have discussed in too much detail, that is the dengue fever, most commonly caused by the 4 serotypes, and this is one of the viral problem, of course, and this is to be transferred, this virus is to be transferred by the Aedes mosquito, and the dengue fever is not too much lethal one anyhow if not properly investigated. So this may leads to dengue shock syndrome or dengue hemorrhage, which will be considered as the severe form of this one. And special sign symptom we have discussed, and then we have discussed the treatment of the dengue fever. So obviously, depending upon the situation, we should have to focus on the condition. If it's a minor one, so of course minor supportive therapy should be there, and if it's too much like a severe condition, so there may be a bleeding tendency, so blood transfusion should be there, and we can say we have to take the support of the infusion mechanism. And severe, in case of severe problem, multi drug therapy should be there. Anyhow, aspirin and ibuprofen type drug should be avoided. Then we have discussed about the pneumonia, sign symptom of pneumonia, causes of pneumonia, and treatment of the pneumonia in case of the newborn babies and children. Then we have discussed about the polio, which is poliomyelitis, which is still one of the problem of the Asian society. Anyhow, vaccines are available, we can easily eradicate this problem from our society. Then we have discussed about the measles, which is one of the problem. Anyhow, we discussed in detail that measles vaccines are available and we can easily treat this problem, and we have to vaccinate properly our newborn babies and children, and the first dose should be recommended at the age of 9 months, where the next dose should be recommended at the age of 15 months.